Number 9, rapid trauma. So rapid trauma is just a quick, brief scan of anything that's majorly wrong with this person, because we're going to do a detailed physical exam at the very end on the way to the hospital. Okay, we're going to start at the head with trauma. Before you palpate, we have to observe. So you have to say, I'm going to expose and observe the head for DCAP BLS. We determined DCAP BLS was deformities, contusions, abrasions, punctures, penetrations, burns, lacerations, and swelling. Expose it, check for any of those items, and then we're going to palpate. You're going to palpate the head for any injuries, check your hand for blood or your gloves for blood, and then move on to the neck. Get used to medical terms, anterior versus posterior, lateral versus medial, that sort of thing. We're going to start with the anterior portion, which means what? The front. For the front, you're going to check 5 things. We're going to go through all this. Stoma. Anyone know what a stoma is? Yeah, basically, right? That's how they breathe. Usually due to throat cancer or something like that, they can't breathe through their mouth. What is a jugular vein distension?
When your veins pop out.
Like when the jugulars are distended. Jugular vein distension. Yes, it's when your veins are popped out. And you'll learn why eventually. When it's backed up, when it's not free flowing to the heart, it's going to be like huge veins just bulging out. Okay. What is subcutaneous emphysema?
Crackling.
Yeah, crackling under the skin, right? There are air bubbles. You'll learn all about that when you take the chest injuries portion of it. It's already online if you want to watch it, or just wait till we go through it live. Okay. Tracheal deviation, what does that mean?
The tracheal moves to...
Perfect. Your trachea is deviated to one side. It's moved over, and that's typically due to chest injuries that we're looking at. If one side of the lungs is collapsed, it's going to move over, that sort of thing. So tracheal deviation. And then lastly, the medical alert tag, you're looking for those things. So you're going to look for those 5 things. Also DCAP BLS. Then you're going to move to the posterior side. On the posterior, you're going to palpate. Palpate the cervical column. How many cervical discs are there? 7, perfect. You're going to palpate each of the discs, and then you're going to palpate for step off and point tenderness. Point tenderness is as you're palpating, the patient tells you, ouch, that hurts right there. And you're going to notate, patient indicated point tenderness at C5 or wherever it is. So you're pinpointing it. What's the alternative? You show up at the hospital, yeah, the patient says the back of the neck hurts. Is that helpful? No, right? I was palpating the cervical collar, patient indicated point tenderness at C5. That's much more professional when you're doing a handoff. And then step off. A step off, you have discs that are kind of stacked on top of each other. With trauma, you could have one of those discs popped out and you're feeling for that step off. Okay? Then you check your gloves for blood, and then you're gonna size and place a C-collar. I brought a bunch of C-collars here for you guys, so you can follow along. Take one and pass it along. Oop. Oop. I'll go on this side. Here we go. I don't know if I brought enough, but I just grabbed a bunch. All right. If not, you're gonna have to share. C-collar. When you look at your C-collar, the first thing we're gonna do is look for the black line. Yep, you're gonna have to kind of share. You see the black line right there? Everybody, I see one person not looking there. Well, wait. Perfect. You see that black line right there? Yep, okay. So from that black line, not the foam, but the bottom plastic piece, that's what you're measuring. I tell you guys to measure for C-collar, okay? So black line to the bottom of the plastic is what you're measuring. What are you measuring? The angle of the jaw to the start of the trapezius muscle. So when I look straight down at this guy, the angle of the jaw to this trapezius muscle is where I'm estimating with my fingers, okay? I'm gonna look straight down. This guy really has no neck, actually. So he's gonna be less than a 2. So now I place my fingers right at the black line and then measure to the plastic piece. That's where I'm measuring. If he has like a huge neck, like Brock Lesnar, it's going to be more, right? So what I have to do is the circle ones pop out. The tabs go outward. If I do it correctly, it's going to be able to adjust. Okay? And then move it all the way. It's going to feel like it's going to break, but it's not. It's just going to flip over. So this chin strap right, or chin pad right here, take it, flip it over all the way. So this chin pad right here, take it all the way. There you go. Keep going. No, the center. Keep going. Keep going. It's going to feel like it's going to break, but it's not. Okay. So this part right here, grab this and flip it all the way over. Keep going. There you go. Okay. That's where the chin's going to go. Yep. All right. So now that I measured, this guy has 2 finger length from the angle of the jaw to the start of the trapezius. Place my finger on the black line and adjust the collar. So this guy's really necklace, right? It should be a number 3 necklace. And then close everything down. And that's the size. What's that?
What if it's number 6?
Number what? 6? Oh, then he's like, has a huge neck.
How many fingers do you measure?
That's all of it. Yeah. That's going to be a guy with like a huge neck. Don't want to mess with him, right? But this guy's going to be, does anybody need assistance with that? Everybody got it? How to adjust it? You guys can move it up and down, adjust it. Because we're going to ask you to size and place a C-collar for your exam. And you'll be able to practice this on your own. When you place a C-collar on a patient, you see the chin pad has a tab in the center. Where do you think that should be centered? On the patient's chin. If it's crooked, you're going to know it's crooked, right? So that tab should be right on the center of the chin. There's another pad down here. Where do you think that should be? Right at the sternum. That's how you know that it's straight, okay? So I place this tab right at the center of the chin. Put this under. Place this tab on the bottom at the sternum. That's how I know it's straight. Everything's straight. And I attach it. This is centered. This is centered. It's straight in line. We'll be looking for that on your final exam. If it's crooked, you're going to transport the patient with a crooked neck. That's not going to do the patient any good.
The idea was changing the distance of this again with your fingers.
So that's the distance between your angle of the jaw to your trapezius muscle.
Oh, okay.
So the angle of the jaw to the trapezius. You can see on this guy right here. So you see the black line right here? And then it should stop at the trapezius muscle right here.
Okay. Got it.
Okay. So a person with a longer or bigger neck, you're going to have to extend this out. It's just adjustable for big neck, short neck. Okay.
You do that before you put it on.
Yep. Yep. You want to minimize how many times you place it, take it off, place it off, because you can do trial and error, but you're going to have to do a lot of manipulating. So now we're done with the neck portion of it. We're going to move on to the chest. Remember, expose and observe first for decap BLS before you palpate. At the chest, you're also going to check for 4 chest injuries. One of them is a flail segment. What did you learn in class about flail segment? What's that? Ribs broken, pieces of the rib broken, right? So what's the definition of a flail segment? How many ribs in how many places?
More than 3 ribs, more than 2 places.
There you go. So it's basically broken, floating pieces of rib. And how that looks like is, I think she showed you a video of it. As the patient is breathing in and out, that piece is popping out, popping in, popping out, popping in. Okay? That's a flail segment. What is paradoxical movement? Opposite movement, basically. So whatever the case may be, abdomen goes out, chest goes in, right? Left and right side moves in a seesaw position. The flail segment pops in and out. Opposite movement is paradoxical movement, okay? How about an impelled object? A knife, there you go. Dang, you went violent. Knife in the chest, yes. That's an impelled object. What's the difference between a puncture and a penetration? Yep, through and through, and the puncture is just the top portion, right? And then lastly, a sucking chest wound, what is that? A hole in the chest. Specifically, it's punctured the lungs because the lung is supposed to be an enclosed cavity and air moves in and out of where? Your trachea. If there's a hole, it's moving in and out of your trachea, but where else? Through that hole. And when there's a hole through your chest, what else is there? Blood, air, yeah. Air, but blood. So it's kind of like making a sucking, slurping noise when it's going in and out. And that's not good. So we'll show you how to treat that a little bit later. All right, expose and observe for decap BLS. I'm also going to check for punctures or penetrations or impaled objects, I should say. Sucking chest wound, paradoxical motion, or flail segment. And then I'm going to palpate. In EMS, you have to be professional this day and age. There's a lot of people taking video. If we're out here and the guy has a broken leg and it's like a scene, what do you think some people are doing? Sticking out their cell phone and recording for their Instagram, right? Saying, look what I saw today. If this patient dies, what's going to happen? EMT came over and killed the patient. So when you're palpating, your fingers are together, your thumbs are in. You palpate the sternum right here, straight down. You're checking the integrity of it for tick. When you palpate the rib cage, I'm not doing this because what does that look like? EMS groping a patient. Straight down, palpate. Try to make that look like groping. It's hard. So professionalism, we have to think about that this day and age. Lateral to medial, anterior to posterior. We're checking for tick, any broken bones in that area. Okay? Any questions on that? So again, expose and observe for decap BLS. I'm going to check for the 4 chest injuries. Then I'm going to palpate anterior to posterior, lateral to medial. Then I'm going to auscultate the lung sounds. We assessed it during breathing. Now we're going to auscultate. Auscultate means using a stethoscope. And you're going to auscultate there, put the bell of the stethoscope on that side, bilaterally. Basically, you're checking for lung sounds right side, lung sounds left side. You're going to be taught a lot different method over in medical. You're going to check each lobe in medical. In trauma, mid-axillary, and that's it. Any questions on the chest? Then you come down to the abdomen. Guess what we're going to do? Expose and observe for decap BLS, plus eviscerations. You're going to observe for eviscerations. What's the evisceration mean? What's that? What's that? Yes, you're cut open, but specifically, what's hanging out? Yeah, your internal organs are outside of the body. Okay, how do you treat that? Put it back, yes. Perfect. Just shove it back in. No, don't touch it. If your internal organs are popping out, spilling out, doing whatever, we're going to put a sterile, moist dressing on top of it, cover it with an occlusive dressing, and transport. Because they're going to have to take each organ, assess it for damage, repair it, clean it, put it back the way it's supposed to go in. Can we do that out in the field? No. So we have to transport the best we can. Sterile moist dressing, occlusive dressing, backboard, and transport. Okay? We're also going to check for distension. What does distension mean? Distension. What's that? There you go, when you're distended, yes. Like a, I don't know, huge belly that's kind of like almost popping like a balloon. It's not normal, that's distension. Okay. How about rigidity? What does rigidity mean when it comes to the abdomen? What is rigid?
Hard.
Yeah, hard, right? You ever see that shirt that says, don't be rigid? Rigidity is when your abs are abnormally hard. So have you ever had like a Charlie horse? Have you ever actually touched your Charlie horse? That thing is like bunched up and it's like a rock. That happens to your stomach muscles. It's just crunched up and it's hard as a rock. Okay, that's rigidity in your abdomen. So when you go to palpate, it's like, oh man, it's like super hard. What is rebound tenderness? Yes. Yes, correct. We know what tenderness means, it hurts, but rebound tenderness is when you push in, not much hurts. When you let go, it hurts. That's indicative of internal injuries, okay? And then pulsating masses, if there's anything bleeding inside, it's closer to the heart, so it's gonna be pulsating and it's gonna be warm, if not hot. So you're gonna feel that pulsating mass. Injuries on a human tend to pulsate. Have you ever stubbed your toe or have you ever stubbed your finger? What does it do? You can feel it like throbbing, right? Injuries tend to throb. It's because the pulse is kind of like pushing the blood through that area. All right, now we get into the pelvic area. Expose and observe for decap BLS. I'm gonna palpate for tick. The bony part right here, the pelvic area, anterior to posterior, lateral to medial. And then I'm also checking for VIP. I heard her talking about VIP. What is VIP? What's the V stand for? Vaginal discharge or bleeding. This is gonna be not normal vaginal discharge or bleeding. Okay, it's due to internal injuries. What does the I stand for? Incontinence? What is that? Not instability. Incontinence.
Yeah, incontinence and crowd.
What is incontinence?
Urine or
Yes, urine or feces. So it's called defecation. When the person defecates or urinates, pure poop. Is it normal for a human to pure poop without conscious thought? What would cause that? Head trauma? You lose bodily controls. It's your autonomic nervous system just losing control. Okay. For instance, when you're watching UFC, when somebody gets knocked out, kicked, knocked out, what typically happens to their body? It either goes limp or it gets rigid, either one, okay? That's the body's, the head losing connection with the body. That's what it is. And decerebrate is the worst kind, which means flexing out. So if you Google, when you get a chance, Rich Franklin knocking out Nate Quarry, you'll see that. He gets hit, boom, right in the face, and Nate Quarry just extends out. He is like a backboard when he hits. He's just like solidly like hard. That's brain injury right there. Okay. Can that happen in a car accident?
yeah.
Yep. So when you show up in a car accident, you can see the guy like, or you can see the guy limp, right? So decerebrate versus decorticate, you'll learn that. All right. Let's see, incontinence and priapism. What is priapism? She just taught it, I heard it. I think you guys were laughing. Huh?
They knock out and they're like stiff or they're.
No, that's a decerebrate or decorticate, yes.
Isn't it when you get hurt in a certain vertebrae and you get like your penis, you get an erection?
Yes, it's an uncontrolled erection. Yep. That is because the brain is not communicating with the body. Yes. So you're going to check for three things right there. Vaginal discharge or bleeding, incontinence, which is pee or poop, or defecation or urination, or priapism, which is an uncontrolled erection. Okay. And this is medical. You guys are getting into EMT, the medical profession, for the first time, right? Who here has worked in a medical profession before? As a licensed person, like an EMT paramedic? No? This is your first time, I'm assuming. Get used to talking about uncomfortable things, because in medical, you're going to get a lot of it. So get used to talking about uncomfortable things. So you may respond to a car accident, and you may see vaginal discharge. You're going to have to explain to the doctor, I was examining the patient has vaginal discharge. It's medical. So get over all the uncomfortableness, if that makes sense. Okay? Expose the thighs. Expose and observe for decap BLS. Palpate for tick using offset pressure. Yes?
When exposing, are we taking out the clothes or are we cutting?
It depends on the situation. So if the person has a broken ankle and you're checking the body, right? Are you going to cut off their $200 Lucky Jeans? Probably not. If the person is unconscious because of a head trauma and you see actively uncontrolled bleeding, what are you going to do? That sucker is getting cut off. So it all depends. Same with the motorcycle accident. There's motorcycle accidents or motorcycle helmets that are $800, $900, $1,000. So a simple motorcycle crash that's sliding and the guy's talking okay, you're going to be a jerk and cut that off? No, just take it off nice and neat. So it all depends. So expose and observe for decap BLS. I'm going to palpate for tick using offset pressure. Okay. At the knees, your second transport decision. This is going to be your load and go criteria 4 through 7. You guys remember what 4 through 7 is for load and go criteria? This is your very first cover page. Flip to your very first cover page. Halfway down, load and go criteria. We went through the first 3 already. What's number 4? Abnormal chest. What's number 5? Tender abdomen. What's next? Unstable pelvis, bilateral femur fractures. If any of those conditions exist, this is your second load and go criteria. And so the first 3 might be stay and assess, but then you found bilateral femur fractures. Now it's a load and go.